How is alcohol-related brain damage diagnosed? Have you ever wondered how medical professionals determine if someone has alcohol-related brain damage? It's a complex process that involves various steps to ensure a proper diagnosis. First, a detailed clinical examination is conducted to assess cognitive functions. This includes evaluating memory, attention, language, and behavior. A common tool used in this assessment is the mini mental state examination, which helps screen for memory and other cognitive issues. However, this test alone may not be enough to pinpoint alcohol-related brain damage, especially if the evaluator is not experienced with this condition. Next, a thorough medical and drinking history is essential. Doctors look for patterns of alcohol consumption that may be harmful. For men, this typically means averaging 35 or more units of alcohol per week. For women, it is 28 or more units. This pattern should have been present for 5 years or more. Additionally, cognitive symptoms should appear within 3 years of this drinking pattern to support the diagnosis. Gathering information from family or caregivers about changes in behavior or functioning can also be very helpful. Physical and neurological examinations are conducted to rule out other potential causes of cognitive impairment, such as vascular or traumatic brain injuries. Blood tests may be performed to check for nutritional deficiencies, particularly thiamine, which is vitamin B1. Deficiencies in this vitamin can contribute to brain damage in individuals who consume alcohol heavily. Brain imaging plays a critical role in diagnosing alcohol-related brain damage. Magnetic resonance imaging is often used to reveal structural changes in the brain. This imaging can show shrinkage in specific areas, such as the frontal lobes, cerebellum, corpus callosum, and hippocampus. These changes reflected the damage caused by chronic alcohol use and related nutritional deficiencies. Imaging can also help differentiate alcohol-related brain damage from other neurological conditions by identifying or excluding focal lesions or vascular issues. It is important to note that some cognitive impairments may improve with abstinence from alcohol. Therefore, a full assessment is often recommended after a period of at least 3 months without alcohol. This helps to distinguish between temporary effects of intoxication or withdrawal and more permanent brain damage. In summary, diagnosing alcohol-related brain damage involves a combination of clinical cognitive assessments, a detailed history of alcohol consumption, physical and neurological examinations, blood tests for nutritional deficiencies, brain imaging to detect structural changes, and collateral information from family or caregivers. Follow-up assessments after a period of abstinence are also crucial to confirm any persistent impairments. This thorough approach ensures that alcohol-related brain damage is accurately identified and distinguished from other causes of cognitive decline.